Tackling gambling harm is incredibly important for Liverpool because gambling harm does impact so many people in our city. We know, for example, particularly young people, 1 in 6, 18 to 24-year-olds are potentially impacted by gambling harms, and so it is crucial that we support them.
So Liverpool's taking a new approach to reducing the harms caused by gambling. We know gambling harms are often related to things like mental health challenges, financial insecurity, use of substances like drugs, alcohol, smoking, and also poor lived experience in the early parts of people's lives. So it's really important we take that public health approach to reducing those harms from gambling.
We know research is really important to help reduce gambling related harm because it helps us to understand the extent and nature of the problem. It also helps us to understand who's most at risk of experiencing gambling related harm, so that then interventions and support services can be targeted at those groups to provide them with the adequate support.
This plan is about bringing partnerships together, so between the council but also service and support in our local communities and people as well. This is about raising awareness of gambling harms and making sure that people are aware of the signs so that we can support people in our communities going forward.
Chapter 1 has been working in partnership with Liverpool City Council to deliver a gambling harm campaign. Our target audience was young men 18 to 35 in Liverpool City Centre. So the aim of the campaign was awareness raising, and we tried to remove as many barriers as possible for the people to engage with the content.
We're aware that many people face challenges around accessing support for gambling harms. Stigma is a huge barrier. People feel ashamed and so they don't come forward for support, and that can lead to problems getting worse. Our role is to provide non-judgmental support. We hope that the launch of this action plan will lead to more people recognising gambling as a health issue and being able to talk about it more freely.
So this plan gives an approach that's rooted in prevention, early intervention, using the data and the evidence base to make sure people get the proper access to treatment and support, as well as reducing the environmental factors that increase risk from gambling in the first place.
So it amplifies the whole system setting in that prevention and awareness are combined with treatment. So we know there's local clinics that people can access that are free, confidential and remote. But it's really important to have that prevention element as well and that awareness.
We're aiming for this plan to have a really positive impact across our communities, reducing the harm from gambling, improving awareness of the harms that gambling can do, improving access to treatment and support, and reducing the risk that some of our communities experience around gambling harm.
Referrals will be smoother, resources will be more consistent across services, and crucially, it will mean people get the support that they need sooner.
Ultimately, this is all about improving life chances and extending health and